infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, a University of Florida entomologist recently urged Floridians to protect themselves against biting mosquitoes because of the unusually high levels of mosquito-borne virus transmission, in particular, Eastern Equine Encephalitis, or EEE, and West Nile virus, in sentinel chickens, in horses, and in humans so far in this summer. So joining me now is said entomologist, Jonathan Day, Ph.D. Dr. Day is an entomology professor with the UF Institute of Food and Agricultural Sciences. Dr. Day, welcome to the show, sir.
Thank you.
Well, let's go ahead and start with the mosquito-borne viruses circulating in Florida at high levels this summer. Dr. Day, can you explain to the audience what is EEE?
EEE is also called Eastern Equine Encephalitis. It's a virus that is transmitted by mosquitoes. As the name implies, it's primarily an infection that occurs in horses, but every once in a while we'll get years in Florida where we get a number of human cases, and this has been such a year.
Right, and it's a pretty serious infection in humans, too.
It really is. The overall number of cases in Florida are always low. There's never been a major outbreak involving 20 to 30 to 40 human cases the way there has been in other parts of the country, particularly Massachusetts and New Jersey. But people that get infected, almost all of them, if they survive, have lifetime adverse neurological impact. So even though it's a rare infection, for those who do get infected, it is a very dangerous and usually lifelong impacts from the infection.
Sure. And probably a disease that more people are familiar with is West Nile virus. Can you talk briefly about that?
Yes, West Nile virus is another one of the mosquito-borne viruses. It came into North America in a well-publicized event in New York City in 1999 and then rapidly spread across the entire continental U.S. It came into Florida in 2001. It is a virus that is spread by mosquitoes. The case fatality rate for West Nile in humans is not nearly as high as the case fatality rate of Eastern Equine Encephalitis, but many people who are infected with West Nile suffer lifelong neurological impacts from the infection.
Right. Now, you talked about that they're both mosquito-borne viruses. Is the same mosquito vector behind the transmission of both?
Probably. And I say probably because with Eastern Equine Encephalitis, there are actually two distinct cycles. One is a cycle that occurs in hardwood swamps in nature, and the mosquito that is involved in that is very unlikely to be the same mosquito that transmits to humans. So during particular years like this year, the environmental factors favor the escape of the virus either in infected birds or in infected mosquitoes out of the swamps, and the establishment of secondary transmission foci which involve other mosquitoes. And so it's very possible that the mosquito that transmits West Nile to humans and the mosquito that transmits Eastern Equine Encephalitis to humans is the same species, but I suspect that there are other species involved in the transmission of Eastern Equine to humans.
Okay, good. So you mentioned in this press release that we're seeing pretty high numbers in Florida this summer of both, I guess, but mostly Eastern Equine. What kind of numbers are we seeing?
Yeah, the horse cases, Eastern Equine Encephalitis horse cases, we're up to about 55, I think, somewhere around that. Most of them are focused in North Florida, north of Orlando, and east of Tallahassee. And we have seen, so far there have been 3 human cases this year. But the factor that we use to determine the level of transmission is sentinel chickens.
Right.
And many of the mosquito control programs have a sentinel chicken program where they place sentinel chickens into the field, and periodically, usually once a week, a blood sample is drawn from the sentinel chickens, and it's tested for antibody to Eastern Equine Encephalitis, West Nile virus, St. Louis encephalitis, and another virus called Highlands J virus. Mm-hmm. And this year, for West Nile, there have been 188 positive sentinel chickens in Florida, and that's pretty high. And that's been in 3 transmission foci, one up around Walton County in the Florida Peninsula, one in northeastern Florida in Duval and Nassau County, and then one down in Sarasota County from Hillsborough, Charlotte, and Sarasota County. So that's a lot of sentinel chickens, and we're seeing more each week. And with Eastern Equine Encephalitis, we've also seen a large number of sentinel chickens. There have been 140 positive sentinel chickens so far this year. Most of those have been in that North Florida area where we're seeing human and horse cases.
Yeah, something else I found interesting was there's actually quite a few emus that were infected with EEE this year.
That's right. Emus are highly susceptible to infection. They show they're very much like horses. When horses get infected, they show neurological symptoms very soon after being infected, and then for the most part they die. Emus are the same, and emus. I did some work in Volusia County on emus that were being infected with Eastern. And a lot of the emu farms are old turkey farms that have been taken, that have been purchased and then restructured for emus. And a lot of times they back up to some of these hardwood swamps. And the one in Volusia County was right next to a hardwood swamp where we know there was Eastern transmission every year. And it didn't take much for the infected mosquitoes to get into that emu farm. And they will wipe out an emu farm. So you're right. I think there have been 2 or 3 instances this year of large numbers of emu infections at some of these farms.
Yeah. Okay, and let me go ahead and close with this. Perhaps the most important part of this interview for the public is, Dr. Day, what kind of protective measures do you recommend for the public?
Well, I think first and most important is that individuals need to know their risk, need to know the risk of where they're going to be active, what the risk is. And for the human cases that we've seen so far this year with Eastern, all of the people that have been infected report that they've had significant mosquito exposure. And I'm assuming that means that they were camping or hiking or out at night when mosquitoes were active. And so I think it's really important to know where the risk of Eastern equine encephalitis transmission is highest. And if you plan to camp or hunt or fish in that area, and you're going to be out during periods when mosquitoes are active, and that's around sunset and around sunrise, to wear protective clothing, avoid mosquitoes if you can during that period of time, and to use a repellent that is effective. And the most effective repellents are repellents that contain the active ingredient DEET, D-E-E-T,
right.
And that's clearly stated on the label.
Well, very good. Let me ask you one more thing since I got you here. How is the Aedes aegypti mosquito situation in Florida this year?
Yeah, that's Aedes aegypti is a mosquito that is primarily an urban mosquito, and so it's associated with cities. And you can remember the Zika outbreak in Miami Beach was Aedes aegypti, and that was in a very urban area of Miami. And so those populations tend to follow environmental factors the way most mosquitoes do, and it's been a particularly wet year this year. So I think that in urban settings, the Aedes aegypti are probably very abundant, probably more abundant than they are during a normally summer that tends toward a drier summer. This has been a very wet summer, and that definitely favors all mosquitoes.
Well, very good. I want to thank you, Dr. Jonathan Day, for your time and your expertise, sir. I appreciate it.
Thank you.